Center, which is a visiting physician practice where we go from house to house, and we also do a healing clinic every Tuesday and Thursday, which is a form of our pain management services. But I don't like calling it a pain clinic or pain center. I call it a healing clinic because we believe in treating the whole person from the inside out. How many of you know if you're under a lot of stress or duress or emotional stuff that's going on, that it can cause your promote disease or heighten a person's disease state or cause more pain. So we try to give people wherewithal from the inside out, spiritually praying, spiritual principles on how to get a handle of things that may occur in their lives so they can be mindful of the fact that there is a greater power, which I do believe the Lord Jesus Christ, who bore all our sickness, infirmities, and disease, so we don't have to bear those burdens of life and deal with disease in our lives, and try to educate patients on that. And there's myriad of studies out there from Harvard, Yale, and Stanford that I have quoted and have given you guys to look up on the importance of prayer and people managing their sickness, infirmity, or disease, whatever they may be dealing with. Hey, Miss Mazine. Hey, Doris. Hey, Miles. Could you guys please like and click the share button as you guys come on? It'll be most helpful if you do that. Our telephone number, if you want to get in touch with us to schedule a visiting physician services for the elderly, 65 and older, or just disabled, or the sick and shut in that can't get out, you call 248-356-1111. That's 248-356-1111. I think it's option number 1 for the scheduler. And if you're someone under the sound of my voice and you're interested in alternative modalities, we also do concierge services where we incorporate a lot of alternative measures. And even in our healing clinic, we do incorporate natural things into our regimen. We do infusions that is comprised of 12 plants. We do vitamin B12 injections and infusions, and we also do what we call vitamin infusions. So what we do, we actually check and see where people's levels are and then supplement them where they're deficient in. So because most oftentimes when people are on medications, it depletes the body of something. And if you're dealing with a chronic illness or disease and the state, your body is deficient of something. And so instead of just giving a pill or pharmaceutical drug to treat a symptom, we need to assess and see what the deficiency is and supplement that deficiency so you can be whole. Hey, DeQuindara, thank you for joining on. Please like, invite, and share as you guys come on. I thank you for joining on. We're on Facebook, Instagram, and YouTube. So please like, invite, and share as you guys come on. Please do that. Please, 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 please. Let me see here what we're doing here. Please like, invite, and share as you guys come on. Like, invite, and share as you come on. Let me get out of here. There we are. We're going to be talking about African American history. I want to talk about how many of you have heard Dr. Sebi? Have you guys ever heard of Dr. Sebi or Sebi, however you want to say it? I have studied his work and look at his work, and believe it or not, what his work makes sense. I mean, if you have been following me for a while now, based upon what we're talking about is based upon how he practiced. Now, Dr. Sebi did not have a medical degree. He did not have he was self-taught. He was from Honduras, and he was born in 1933, and he died, I think, in 2016. I do believe he passed on because of pneumonia. And then there's a lot of people who say that they didn't believe, can I say, some controversy or conspiracy theories why he passed, being that he was a holistic person or herbologist or whatever you want to call him. You know, he did pass, and some people think because he was using natural remedies to give people what they needed to be healed, a lot of people think that he was um, murdered. I mean, let me just be real about it. People think that he was murdered. So, but I want to give a tribute him tonight, African American History Month, because they actually took him to court. Um, they actually took him to court and to say that he was practicing medicine without a license. And so he was found, guys, not guilty because he was not practicing medicine, so to speak. He was not practicing medicine. He was not using pharmaceutical drugs. So how can, or writing scripts, he was using natural things. So if he was using natural things to help the body or to heal it, hey Mio, thank you for joining on. Hey Maria, thank you for joining on. And then he had tons and tons of testimonies where he healed people of HIV, where or he used some remedies to help people be healed from herpes and things of that nature. They found him not guilty based upon the accounts that were set against him that he was practicing medicine without a license. So medicine is actually using pharmaceutical drugs to treat people ailments, and he was not doing that. So he was found not guilty. So he was. They call him Dr. CB, but he was born Dr. His name was Alfredo Bowman. He was a Honduran herbalist, and he was better known as Dr. CB or Sabi. He was a Honduran herbalist, and he also had a what they called a healing sanctuary in Honduras, where people could go and spend $1,500 per person to stay 3 days to partake of the serenity of the place and eat of the good food that they had there and learn about how to get your body in a homeostatic place in order for it to heal itself. So basically, that's all I've been talking about since I've been on here. I haven't gone into the herbs and things of that nature in detail like I would like, because I feel if you come on board and you're interested in the things that I am talking about, you'll make a phone call, make an appointment, and get a consultation, and then we can talk about the herbalist or the homeopathic or the naturopathic side of what we provide. I can't give it all here on Medical Monday for free. I have to make a living. I gotta make a living. So, let me get back to to what they call him, Dr. Sabi, Alfredo Bowman. They said he claimed to cure all diseases with herbs with a unique vegan diet or vegan food choices based upon various pseudoscience claims, that they call it. He was born November the 26th, 1933 in Honduras. He died August the 6th, 2016 in Honduras. Of course, his nationality is Honduran. He was married to Patsy Bowman, or Mrs. or Dr. Sabi's former spouse, Miss Mahia Bowman, his first wife. He had a daughter, and her name was Samaya Bowman, and his parents were Clifford Bowman and Violet Francis Bowman. But he had impacted the homeopathic world with what he was saying. What I guess you're saying, what does he have to do with tonight? Well, I'm giving him a shout out and a tribute to African American history. And you know, in the past, I have talked about the first female black doctor. I've talked about other doctors, you know, during Afro American History Month. But and I never talked about him, and this is my first time talking about him this year. But the main reason why I'm talking about him tonight, because we're talking about inflammation, and the basis and the foundation of his work was that he felt that mucus is what was the cause of most disease states. So if you're someone under the sound of my voice, you're always coughing and bringing up stuff and all that other kind of stuff, you're high mucus. But that mucus, let me tell you something. What is the purpose of mucus? Mucus is formed in the body to calm things down. So what we're talking about is inflammation. So underneath the mucus is inflammation. So if you're not controlling the inflammation, guess what? You're going to have mucus. And if you have mucus, a person is going to have disease. And so that mucus can be in the nasal passages, can be in the pharynx, the throat, and the lungs, and the chest, in your gut. Yes, it can. Anything where there is mucosa or cell linings and things of that nature, a person can have mucus. And so why does a person have mucus? Because they're inflamed in some type of way. And so the foundation of pain, and I talk about this all the time with the people that come to our healing clinic, you have to get the inflammation under control. The medication that is being prescribed, the pharmaceutical, be it an ibuprofen, be it an aspirin, be it an NSAID, or being in a narcotic. Hey, DeQuinder, thank you for joining on. It is just treating a symptom. It's just masking the pain. What it does, it works to block the pain signals so the person doesn't feel the pain. I often say this all the time, almost every show. It's like being in a boat with a hole in it, and you got a pot pouring out the water, but there's a big hole with this water gushing in, and so the pain medication is just a pot, or the high blood pressure is just a pot, or medication, or whatever the person may have. Crohn's disease, they have these drugs that are injections to Humiras. Even people that have skin diseases or like eczema, psoriasis, all of those are a manifestation of inflammation. So your body goes through this when a person is exposed to an allergen or to what we call a toxin or whatever. The body responds to it. So how do we get the toxins on the inside? It's by the things that we eat, or the air that we breathe, or the environment that we're in, or the things that we put on our skin. But most oftentimes it's the things that we eat. So that's why it's so important to eat clean. And what is clean? No antibiotics, no hormones, no processed foods, things that are on the label that are more than 5 syllables long, that you have to break the word down in order to pronounce it. Those things can cause an inflammation and an inflammatory reaction within the body. And if you are inflamed, and then there is pain. So it is very, very important that we manage and control the pain. And that was the basis of Dr. Sebi's work, saying that mucus and viruses and bacteria, they thrive in an acidic and an inflamed environment. So if you destroy the environment that they thrive in, it only makes sense that your body will auto-correct itself. It will flush itself. It will detox itself. It will get those things that are in your body out for your body to be in homeostasis in order for it to auto-correct itself. So it was amazing, his life work, what he had done, and what it is carried on now. I've heard that he had a whole product line that was phenomenal. I have never tried it, and I'm a skeptic in trying it, because I have read some articles and I have read some reviews that since he made his transition, he's no longer here. Since he's died, that his products are not as good as they were when he was alive, because people look at what he was doing as a business versus when he was doing it. He was looking at it as part of his passion in helping people, which was a business as well. But most oftentimes when the founder leaves, if they don't have a protege or someone that they duplicated themselves in, people can acquire the business, and the sensitivity and the purpose and the mission of his passion can be lost and can turn into a business. And so they will compromise on the formulas or the combinations of the things that he made, like his cell regenerative herbs and supplements like that. I heard they're not as good. I'm based upon my reading. I have no personal experience on it. You guys know when I'm on here and I recommend a product or I suggest a product, it's because I've tried it and I've had experience with it and I've had great results with it. So And in the process of all of that, I'm trying to get my own line together. You guys be praying for me in regards to that, because I do want to have my own product line, and I want it to be custom. And what I mean by that, by it being custom, is because we do testing to find out what you're deficient in. So your regimen, your regimen, or what I come up with, will be specifically tailor made for you. So Miss Mazine, once we get you where you need to be and get your results in, what we come up for you, Miss Mio or DeQuinder can't use, or Tanisa can't use, because everybody is an individual. Everyone is created and uniquely created and designed. God knew you before he formulated you in his mother's womb. And so no one is the same. No one has the same fingerprints. No one has the same retina scan. No one has the same voice print, even though people sound the same or sound alike, but the voice pattern is different. Everyone is different. So people's combination of their deficiency that they may have may not be for everyone. So my product line will be custom for the individual. So it will not just be this is the situation, and because there's no different. If we don't do it custom, there's no different than it being a pharmaceutical drug, right? A pharmaceutical drug is one size fit all. So I don't want to use supplements and herbs in the same way, because everybody is different. So it one fit all. So again, even though it may be safe, and I've said this before, or considered natural, it may not be considered. It can be misused and can be harmful. Hey, Diana Brown, thank you for joining on. Please like, invite, and share. Click that like button and click that share button. We're talking about Dr. Sebi tonight, who was born, his real name is Alfredo Bowman. We're talking about the contributions that he's made into the medical world, on the alternative modalities of things that he has done in regards to his work, about mucus is the foundation of disease. That was his premise, but I'm taking it a step further. For a person to have mucus, they have to have inflammation, and that's what we're talking about. So when a person becomes inflamed, inflammation, let's look at that for a minute. When a person becomes inflamed, there's a chemical cascade that happens, that causes inflammation in the body. So let's say, for instance, inflammation in your body's way of protecting itself from infection, illness, or injury. As a part of the inflammatory response, your body increases its production of white cells, immune cells, and substances called cytokines that help fight infection or injury. So let's say, for instance, a person is exposed to a virus or a cold. What happens when a person first get infected with a cold or a flu or something? They either get a runny nose right away, or they feel tickliness in their throat. Mucus may start building up in their throat, and then it gets inflamed. So then the inflammation in the nose, what we call the nasal nerves, get kind of swollen because they're inflamed, because they've been exposed to a virus, which causes the stuffy nose along with the mucus, which causes the tickliness in the throat and the throat pain, because the body is actually sending things to that area to help it heal itself, right? So what the body is doing is sending white blood cells, cytokines there to fight the virus, okay, to get rid of it. So this is what I also tell people: within the first 24 hours, if you have a fever, to me, the fever is fine, because that's your body's way of burning it out, okay? Because your normal body temperature should be anywhere between 96.2 to 99. 99 would consider a low grade fever. But when you're exposed to that virus or bacteria or something, Your body's way of fighting it is fever. It brings the body temperature up to say, hey, we need to burn this out, get rid of it. So that's why some people, when they say they have a cold, they'll put on a whole bunch of sweat clothes, they'll get under a whole bunch of covers, and they say, let's sweat it out. Okay, there is some rationale to that, and there is some logical things to that, and there are some helpful things to that. But you all, as you sweat, you have to replenish, because you're releasing electrolytes, which is sodium and potassium, and you need to replenish that if that's something you decide to do. So in the first 24 hours of being exposed to a virus or bacteria, fever is fine. And even with children, I tell parents, as long as it's not 102, 103, 104, but if it's low grade, maybe 100 point something, maybe 101, the first 24 hours, I will let them have that little fever, because that's this body's first line of defense. Beyond 24 hours, if it's still high and creeping up, then yes, give them antipyretics, we call them. That's the scientific name from an antipyretic, which is your Motrins, which is your ibuprofen. We try to tell parents to stay away from aspirin in children, and even in adults that are having they are exposed to a virus. We tell you to stay away from aspirins. Hey Susie, thank you for joining on. Hey Annapolis, thank you for joining on. Please click that like button and please click that share button. Thank you so much. So inflammation is, you want it when you're exposed to something, but you don't want it for a long period of time. Okay, inflammation is not good. Chronic inflammation is not good. So what do we call chronic inflammation? For me, in my definition of chronic inflammation, anything that is past, to me, is considered chronic. So let's say, for instance, if a person injured themselves, and I've had this discussion with some of my seniors. If a person falls or twists their ankle or something, you need to put ice on it right away. Now, this is just a generic blanket situation. Hey, Gwendolyn, thank you for joining on. Please like, invite, and share as you come on. Now, if you're someone under the sound of my voice that can't tolerate cold for whatever reason, I'm not talking to you. So those are some people that might have sickle cell disease, or someone may have Raynaud's syndrome, which have an intolerance to cold. Can make the situation worse than better. I'm not talking to you. I'm talking to people that might have an acute injury. You're supposed to put ice within the first 24 hours, along with an anti-inflammatory schedule. So that's Tylenol every 4 to 6 hours. That's Motrin every 6 to 8 hours. Whatever your body can tolerate, or even aspirin if that's something that you can do. I highly do recommend that to keep that inflammation down, because if you don't get the inflammation down, right, and increase the amount of pain, and it will cause the injury to be worse. Because if something is, let's think about it, if something is swollen and inflamed, right, and it needs to heal, if it's swollen and inflamed, it can't heal like it should. So you want to bring the swelling down, and you want to bring the inflammation down, so things can line up and heal properly. So that's why, controlling inflammation is very, very important. So that's why I tell people you have to watch what you put in here, what you eat, because that can promote inflammation within inside the body, which causes what? pH to go down, cause acidic state, which increases inflammation, which increases mucus, which increases disease. And even in joints, let's talk about that. We'll start from the top of our heads to the soles of our feet. Let's just start there. So chronic inflammation in the brain has been known to be the sources of what type of Alzheimer's disease, dementia, vascular dementia, or protein deposits from which is a protein that is deposited in the brain, which causes Alzheimer's disease. But that protein can only stick if it's inflammation. So it's very, very important that you keep the inflammation down by controlling what you eat, drink plenty of water, and get plenty of sleep. And I talked about this, about the importance of getting the right amount of hours of sleep, because when you're sleeping and get the right amount of sleep, the right type of sleep, it helps get those proteins and keep the inflammation in the brain down. Sleep deprivation and Alzheimer's has been strongly associated with Alzheimer's disease, along with uh, the protein deposits. Like I said, not getting enough sleep, but also with infections in the mouth. So that's why dental, taking care of your mouth and taking care of your teeth is very, very important, because your mouth is very close to your brain. So if you're someone under the sound of my voice that has gingivitis, or known to have mouth abscesses and things of that nature, which is a form of inflammation. Yes, it is. Um, you're very it's very close to your brain, which can be contributing to dementia and Alzheimer's disease later on in life. So all of that goes together. Okay, so and let's even talk about the eyes, okay, for a moment, and about keeping inflammation down. Inflammation has a lot to do with the optic nerves, retinas, and your lenses and all of that kind of stuff. And people who wear glasses, they don't want to talk about that. They just want to say, um, I remember when I first realized that I needed glasses was when I was in medical school doing a lot of reading under a lot of stress, and I couldn't see the blackboard. So I got glasses, but that's when I really, medical school was so stressful for me. Oh my goodness. Let me tell y'all a story, a true story. When my first year of medical school, right before the Christmas holiday, my daughter got gravely ill. I mean, I had took the exams right before Christmas, and I'm getting, and I was in medical school. I was in medical school, working at Henry Ford Emergency Room, and in cosmetology school, all at the same time. Who does that? And a single mom. Okay, who does that? I did it. So I get this phone call that my daughter is in the hospital at Mount Carmel and she can't walk. And the night before, she was telling me that her back hurt. All right, some of you may have heard the story before, but I was like, oh my goodness. But all during medical school, it was very stressful for me. Um, but anyway, I had to take some time off because she was in the hospital all through Christmas. That was when they made the announcement of the Iraq War. Okay, we went to war. My boyfriend at the time moved into with his ex-girlfriend, and they had a baby together. I'm in medical school. My daughter it was just woo, a whole bunch of stuff. That's my story, but it's a true story. But God, I thank God. I just thank God that He saw me through that. But anyway, but during that time, I had my eyes were starting to go bad, and I'm quite sure it was because I was deficient. I'm quite sure because I was under a lot of stress. I'm quite sure my body was inflamed. So now, I was wearing, my glasses were so thick they had to do those high indexes. So even though I went to this store that did the eye exam free, and you get two glasses for a certain price, after I did the lenses and all the indexes and all that kind of stuff, I was paying $600 and $700, sometimes $800, including top contacts every year for glasses, because my eyes were getting progressively, worse. So it had got to the point I was like, I can't keep doing this. So I did invest in getting my eye surgery done. And they said at a certain age that I probably would need readers. But being that I took the time out to educate myself on the deficiencies and inflammation, when I find myself doing like this, I know it's time for me to supplement and to control the inflammation that's in my head area, and my eyes, and to make sure that I supplement myself. And once I start doing my supplementation, where I don't have to do this, I know that I can back off. So I don't supplement myself when I know I'm deficient continuously. I modulate myself to when my vision is getting better, then I stop. So because your body does build tolerance. Let me say that again. Your body does develop and builds tolerance to pharmaceuticals and to natural supplements as well. What is tolerance? Tolerance is different from addiction. Tolerance means that your body builds up to where it gets used to what you're doing and requires more of it. So that's why we have an opioid epidemic, because even though people may have started off at a low dose, now their doses are getting higher and higher, and they're requiring more and more tablets, not because they're addicted. There's a difference between addiction and tolerance. Let me say that again. There's a difference between addiction and tolerance. So tolerance means that your body gets used to a certain amount, and then it needs more to get the same effect that it did when it first was introduced to the pharmaceutical drug or to the natural supplement. So that can happen with either one. Now, an addiction is when a person have addictive behavior, which means that they're secreting dopaminergic effects in the brain that makes them have cravings and make them do whatever they have to do to get it, be it lie, steal, or kill, to get the drug, um, because they have to have it, okay, because they're addicted to it. So a person that's tolerant, they don't have to have it, but they may have a symptom where they have been using it for so long, so now they need to require more of it because their body has become tolerant. So hopefully that explains. Hopefully I explained that clearly. Okay, there's two different things there. Hey Deborah Landy, thank you for joining on. Hey Dion, thank you. Push that like button and that share button. Please do that. So inflammation, keeping it down is very, very important. So I talked about top of the head, which is, you can even have inflammation in the follicles, which can cause hair loss. And we at Bethesda Holistic Center, we do platelet replacement therapy for hair loss treatment. For women and men, they may have some balding in the top or whatever the case may be. We do not claim to say that we have the cure for male pattern baldness, which is genetics, but we have modalities where we can test your DHT levels to see where they are to keep them down so it won't attack the follicle so the hair can fall out. Because I believe if you get the hair to grow for men, you have to keep the DHT at a certain level so it won't come out again. Okay, and women that have male pattern baldness too, there is a reason why. A manifestation of hair loss is something that's going on the inside. So I remember we did the vitamin testing and we found out this lady had a fructose sensitivity, which means when she drinks or exposed to fructose, she said I could get my hair a certain length, but after a while, then it would come right back out. So we come out to find out she had a fructose sensitivity. Fructose is almost in everything, but she loved her root beer floats. I'll never forget her. So once she cut down on her root beer floats or cut them out, she was able to grow her hair and maintain it. So thank God for that testing, and that we were able to address the problem instead of putting topicals on it, shooting her with her own platelets or shooting her with steroids like some dermatologists do. We actually found out the reason why it was coming out in the first place. So we patched the hole in the boat, right? That's what we did. So we can do the same thing for those of you that come in that may have hair issues, that may have eye issues, may have teeth issues. Another story, true story, had another young lady. She was having said that she had um, periodontal disease, and she was doing everything that they were telling her to do, but she was having a challenge. So we did her vitamin testing, come out to find out that she was a little bit of vitamin D and calcium deficient. Both of them need to work together synergistically so you can absorb the calcium. You need vitamin D, and to absorb the vitamin D, you need the calcium. So, but anyway, make a long story short, how many of you out there, providers, did you know this, and even dentists or hygienists or whatever, if a person is low in calcium, they can have periodontal disease because calcium, you need calcium to build strong teeth. And you need to have strong teeth. It helps work at the level of the gum line to keep the teeth attached to the gum. So what is periodontal disease? Is when that teeth is being eroded or that calcium is being lost. So it's separating from the gums, which is causing a space, which is causing periodontal disease. So once we started supplementing her with her calcium, then she was able to get her periodontal disease under control, which is also a form of inflammation. That's deep right there. Also, if a person is deficient, this is my own testimony, be a little transparent here. I was a little bit deficient in calcium at one point in time, and I had to start supplementing myself with calcium. I know I felt like I was bloated or heavy all the time. And the reason being because I was calcium deficient. And then once I start supplementing myself with calcium, so I like to work out, and and of course I do eat right. But once I started supplementing myself with calcium, I was able to burn more fat. So if you're someone under the sound of my voice and you're like, I'm doing everything I know how to do, and just can't release the weight, and I just can't get rid of it, you're deficient in something, or the hormones may be off, and one also works with the other. So a person that may be deficient in something like vitamin D3 is very, very important in building certain hormones, especially in men, testosterone. So a person can be deficient in something which can cause hormones to be off, which causes a problem. So let's talk about heart disease and high blood pressure. We were taught in medical school is because vasoconstriction, and cholesterol buildup in those vessels, which causes high blood pressure. But now training teaches us that cardiovascular disease and high blood pressure and diabetes have a strong inflammatory component. So, getting back to Dr. Sebi, what I was saying earlier. So he was right on the money, even though he may not have an MD degree, he may not have been trained in a whatever, but his concept of inflammation or mucus, which is mucus is a byproduct or as a result of inflammation. If a person is inflamed in their vasculature and their blood vessels, okay, their blood pressure is going to be high. Or in their lungs, let's talk about that. COPD, asthma, all those things that cause bronchoconstriction. There is a bronchoconstriction component and an inflammatory component. So we have to control the inflammation for high blood pressure, for heart disease, for diabetes, and for lung disease. Okay, inflammation has to be controlled. And most oftentimes with lung diseases, they like to give people steroids. So, but at Bethesda Holistic Center, we use an anti-inflammatory, which is made with 12 plants, and it doesn't give you the side effects of steroids. Steroids can cause a person to become bloated, can cause thinning of the bones. Steroids can cause deterioration of the bones. Steroids can cause people to retain water and to swell. I always like to use this as an example. Bernie Mac, who had chronic lung disease. He was skinny as a rail. When they put him on steroids, he just like blew up like a puffer fish. That was because he was taking steroids every day. Now, listen to what I'm saying to you. Steroids have a tendency to make people gain weight and blow up when they have to take them every day. If your doctor puts you on a regimen for a week or something, there's a low probability that you will blow up or gain a whole bunch of weight. I've used steroids in acute situations when someone is really having a whole lot of pain or having breathing problems. Along with the natural remedies, I have no problems with using steroids for a short period of time, maybe like a week or 10 days. And I like to wean my patients off of it. I don't like to abruptly stop them from using steroids. So if you're a provider under the sound of my voice, always taper the steroids. Always taper the steroids, okay? I've seen some patients come from emergency rooms and urgent cares where they put them on 20 milligrams of steroids twice a day for 10 days and just stop. That is not healthy. That is not safe for the patient, and that should not be done. Okay, so if you're a primary care doctor and you catch that because they need to follow up with you, hopefully they'll follow up with you within that 3 to 5 day window. So if they're on that script, that you can taper them appropriately. Okay, that is very, very important. Hey, Lanita, thank you for joining on. Hey, Teresa Thomas, thank you for joining on. Click that like button and that share button as you guys come on. Share, share, share. Sharing is scary. So please share, share, share. So we're now at the level of the abdomen. Let's talk about now, because we started from head. We're talking about the stomach now. Inflammation in the stomach. Inflammation of the stomach is known as peptic ulcer disease, or ulcers, or stress stomach, or my stomach upset, or whatever the case may be, and Crohn's disease or ulcerative colitis in the gut area, diverticulitis. Itis means inflammation. Itis, that's ballooning of the colon, where they have the little balloons that's on the side of the colon, where they tell people that you shouldn't eat any things that are seeds or corn that can get into those little pouches, which become irritating and inflamed and cause a diverticulitis flare up. Or, okay, so irritable bowel syndrome, all those things, leaky gut. Leaky gut, I have found out the major culprit of leaky gut is vitamin B12 deficiency. So if someone has been diagnosed with leaky gut, most oftentimes they're vitamin B12 deficient. So so at the level of the stomach into the gut, inflammation is not good. So how do you calm inflammation in the gut? By what you put in here, okay? So you got to be careful what you eat. Dairy products. A lot of people can't do dairy. We were not supposed to do dairy from another animal past our weaning stage. We're supposed to have been breastfed and weaned off mom's breast, and that's it for the milk. But we like dairy. We like, well, dairy, which is milk. We like cheese, all type of cheeses. We like all that kind of stuff. So our gut is really not designed for that. That's why people, you lack an enzyme which is called lactase. That's why they call people lactose intolerant, because the sugar in milk is lactose, and the enzyme in the gut is the lactase that breaks it down. So after you become a certain age, when you don't have exposed to dairy product, that enzymes is not supposed to be there anymore on purpose. So, but anyway, so that can cause inflammation in the gut. If a person has allergies to certain things, you got to remember your gut is your what I call the um, I want to say the headquarters for your immune system. So if your gut is inflamed, your immune system is jacked. Let's just be real about it. If your gut is inflamed, your immune system is off. So you have to control the inflammation in your gut, so you can be so your immune system can be very, very good. If you're someone under the sound of my voice that catches everything, every time you turn around, every virus, every bug, whatever is going on that's out there, you are catching it. That means your immune system in your gut is not good, and probably your gut is inflamed. Why is it inflamed? You're probably deficient in something. So you need to figure out what the deficiency is, okay? So we can address it, so we can get to the root cause of the inflammation, so then we can build your immune system up via the gut. So that is very, very important that you do that and understand that, okay? So let's now talk about even the reproductive organs, okay? Females, their uterus, their fallopian tubes. I really do believe that we are experiencing a high infertility rate in our nation like never before, because all the hormones and things that they put in our food, along with inflammation. Because a baby cannot implant into an inflamed uterus, or the ovaries cannot release the egg to go through the fallopian tube if it's inflamed or swollen, because it can't get from the fimbriae through the tube to meet the sperm so it can connect and so it can implant into the uterus. So that's why we have tons and tons of infertility clinics, and we have all these anomalies of women who they give them all these hormones and things, and they having 7 and 8 babies at one time. Okay, so and even on the male side, I've in my medical career, I've been a doctor over 20 years now, seen so many men with erectile dysfunction. I mean, it amazes me, and at all ages. Okay, um, you know, it is amazing to see. It's just not the elderly people or the mature people that's having this problem. It's young people too, and I do believe again that it has to do a lot with the hormones that they're putting in our foods. They're injecting our foods, especially if you're a meat eater. They inject them with steroids and inject them with hormones, and all the soy products too, and the estrogen that they put in meats for men. Estrogen and men just don't go. I'm just sorry to say it. They're emasculating our men by putting estrogen into our food source. Okay, so fertility and erectile dysfunction has a lot, like I said, inflammatory component, hormonal component. Also maybe due to anemia because you and due to vasoconstriction and inflammation because you have to get blood flow into that area. So it's a whole lot that goes with that, but inflammation is the source. Okay, so let's go down a little further. Let's talk about the muscle skeletal system, which is the joints. Inflammation can be in the joints. Okay, there can be I do believe the resurgence, or I should say the increase in lupus. I really do believe that has a lot to do with inflammation. I really do believe that has a lot to do with our food sources and how we treat our food and how we ingest our foods. Okay, because lupus is an inflammatory process. Lupus affects the hair, it affects the skin, it affects the eyes, it affects the heart, it affects the joints, it affects the kidneys. Okay, so all of that is inflammatory. So the inflammation has to be controlled. Something that's cut on due to the inflammation that should not be cut on. So that's why chronic inflammation is not good. Dr. Sebi was on it when he said inflammation and mucus together is the source of all disease. Because if a person has chronic inflammation, your body is under a chronic stress state that's going to turn on cells that don't need to be turned on, that's trying to fight this chronic inflammation. So it turns on, and that's when you get renegade cells. That's how a person gets cancer. That's how a person gets tumors. That's how, be it benign or malignant, because of chronic inflammation. So inflammation has to be controlled. So joints, again, arthritis, rheumatoid arthritis. Rheumatoid arthritis is deforming. It causes what we call ulnar deviation, where you see people, this is what we call the baby finger, which is the ulnar nerve. Then you have fingers that go to the ulnar side, which causes ulnar deviations. You've probably seen people with deformed hands or deformed feet or knees, or where their knees go in. Chronic inflammation because of that. So if you could control the inflammation, you can control the disease process. Your body can go into a homeostasis state and correct itself. So you definitely have to control the inflammation. So some things that I like to recommend that people do, you have in regards to controlling the inflammation. Again, you are what you eat, so you have to be careful what you eat. I do believe that you should be on omega 3 fish oil. I'm going to post some links on some products that I recommend. Cytoactive is a product that has vitamin D3 in it, and it has the omegas in it, and it has CoQ10 in it, which has cardio protection in it. It's a little it's like $55, but you're worth $55. Okay. Then there's the iso omega fish oil. Fish oil is very, very calming, which helps keeps the inflammation down. Okay. And then we have a joint support system, which there's a topical and actually a tablet or supplement that you take to keep the inflammation down at the levels of the muscles and joint. And it's only $20, and you worth $20. You blow $20. Anytime you leave the house, you blow $20. Let's just be real about that. But anyway, so you're actually, if you're someone under the sound of my voice that has chronic pain issues at the level of the skin or level of the joints or muscle, that you could take something orally and topically. I believe in combination therapy, and especially in our healing clinic, we just don't pass out scripts. Again, we do a holistic approach. Where's your mindset? Where's your emotions? Where are your stress levels in dealing with family members and things like that? I see more pain in people that are dealing with stress in their personal life and dealing with family members. Hey, Deborah, thank you for joining on. Please like, invite, and share. Please click that like button and click that share button. All of you that are watching, if you're still watching, please do that. Share this. Share it again. Push the share button again. So I've seen more pain in people that are dealing with stressful situations. So sometimes they're medicating more than just their physical pain. They're medicating emotionally too. So you have to address emotional things that are happening in your life. You have to do an inventory, and you have to make some hard decisions. You know, like how they say, if it's you and somebody in the alley, who is it gonna be? Okay, it's got to be you. So if it's someone that's in your life that is causing all this heck in your life, and they're being abusive, they're not being I mean, we had girlfriends out at Great Faith Ministries. Thank you, Dr. Beverly, who is my spiritual mom, and of course Apostle Wayne T. Jackson at Great Faith Ministries. She said that, whom God put us together, let no man put us under. So if someone under the sound of my voice, if you're being abused, and abuse is coming in different forms, verbally, it's not always hitting, verbal abuse, which is a form of emotional abuse. People can also be financially abused, which means that the man controls all the finances and you may not be working right now. And so you're under that thumb of a financial abuse where they're controlling you through finances. God did not create for you to be under that environment and under that stress. And I have dealt with patients that have been in that environment and dealing with that type of stress, and it's manifesting in their bodies. So I can do all the natural stuff, I can do all the pharmaceutical stuff, but if that's not addressed, again, remember, that's the hole in the boat. That hole needs to be patched. So you need to remove yourself from that situation, okay? God didn't create any of us to be in a situation where we're to be abused. That is not normal. That is not right, and that is not good. Okay, so because the body, when it's mentally in a bad place, remember I did a whole talk about that. That the mind releases certain chemicals, right? Let's say, for instance, a person is depressed or being abused and being oppressed. Guess what? Chemicals in the neural system, neurotransmitters are being released. That are negative neurotransmitters that's being released in the body and telling the body to line up to promote disease, versus someone who's happy and laughing and loving life. The neurotransmitters in the brain is releasing good chemicals that's telling the body on the good side that you're healthy, that you're whole, and if anything comes at you, your immune system is up to fight off disease and fight off pain, or whatever the case may be. It has been scientifically proven, and I have proven it in my practice. People that deal with chronic pain, be it emotionally, mentally, or physically, their endorphins are down. What are endorphins? The endorphins are chemicals in the body that help promote a good outlook in life and help fight depression. So if a person's endorphins are low, they're depressed, and it goes hand in hand with chronic disease and chronic pain. So in order to make sure that your body is in a homeostatic place, that's why at Bethesda Holistic Center we treat the whole man. We tell you what you need to do as far as spiritually, as far as the word is concerned, as far as prayer is concerned. When people come to the healing clinic, we play good music. It's not always gospel music, but we also play classical music. We even played some jazz, because all music is not bad music, okay? Everything carries energy, and I just thank God for Apostle who talked about that on this past Sabbath, about your energy has to be in a certain place in order for you to receive from God, to receive from life, in order for you to produce, in order for you to be to overcome procrastination, to overcome a lot of things. Your energy has to be at a certain place in order for you to do that. Your energy has to be in a certain place, and your mindset has to be in a certain place in order to even just work out and exercise. Okay, so in order for your body to be put into a homeostatic place, for it to correct itself, your energy has to be there. And energy comes from the chemicals that are in your body that line up to create energy. So when you have low energy, the body cannot heal itself. When you have high energy, high good energy, I should say, high good energy, because you can have high energy, but it can be bad. Let's be real about that. You can have high energy, but is it good or bad? Okay, so you want to have good energy. And I do believe laughter is merry medicine for the soul. Please put on a funny video. Sometimes I go on Facebook or YouTube to just look at stuff and just laugh. And sometimes it makes me laugh so hard, I'll post it on Facebook as a laugh break. You need to laugh. Don't be so serious all the time. Enjoy life, okay? Tell jokes. Just laugh it up. Just laugh it up. Because it relieves this. The word of God tells us laughter is merry medicine for the soul. So laugh, have fun. Get out, get some fresh air. Even though it was cold today, the sun was out, but the air was crisp. Roll down your window and just take a deep breath and get some of that good air in you. Be careful though, if you're inflamed and have asthma, you inhale some cold air, you might trigger an attack. So, but just make sure that you're straight on the inflammation side before you take a deep breath of some cold air. But anyway, so hopefully this was very informative for you guys tonight. We can't afford what is important to us. That is so true, Jaquinda. I really do believe, and I say this mostly every show, we're not asking you to spend money that you don't have. We're asking you to redirect those dollars that when you know that you're spending on something that you shouldn't, that is not good for you, spend it on something good. Instead of drinking, let's just use this energy drinks. Energy drinks with aspartame is not good. Aspartame burns the brain. So put that money in a jar. When I have people that are stopping smoking, I said, $7.50 a pack. Some people smoke a pack a day. That's $2,600 a year. That's a lot of money. That's a lot of money. $2,600 a year. You can do an all-inclusive trip to Dominican Republic for $2,600 for 3 people. So put that money in a jar. Hey, Carl. Carl, I know you late all the time, Carl, but that's okay. That's why we replay this stuff and record it so you can catch the replay. That's fine. And put that money in a jar, or the 750 times, let's say 7 times, let's say $8. $8 times 7, that's $56 a week. That's a bottle of the Cytoactives for a smoker. Okay, so again, people do pay for what they want to pay for from our hair. I mean, let's talk about how much hair we put on our head and how much money we spend for hair. That's a lot of money. That's something that's going on top of your head that's not going on the inside that's helping you. Okay, getting our brows done, our lashes done. For the guys, haircuts, hanging out with the guys, whatever, smoking, drinking, whatever the case may be, we spend money on what we want to spend our money on. So just invest in yourself, invest in your health. Don't wait until something happens and then try to fix it. For you millennials that are out there, you young people out there, you Google everything. Google about your health. Stay healthy. Don't wait until you like 40 and like I'm gonna start taking care of myself. Start taking care of yourself now. I wish I knew what I knew now when I was in my 20s. And I never smoked. I hung out with my friends and I used to drink, but I was never really a drinker because it really made me sleepy. So when I was hanging out, I didn't like to feel sleepy, so I really didn't drink that much. When I was a teenager, I tried weed. It burnt my lungs so bad. I was like, "Ooh, I can't do this. I ain't like it." So, so I'm just being real with you guys. I did hang out a lot. I used to work a lot. I used to have 100 jobs. So if I knew what I knew now, I would have taken better care of myself back then. But I thank God for preserving in me and keeping me, because He said my latter days will be greater than my former, and I'm standing on that. He preserves it and He keeps me. And people are saying to me, Dr. Grace, what are you doing? You're looking younger and younger, and I thank God for that. I'm not ashamed to say how young I am. I am 52 years old, 52 years young. And I thank God for preserving me and keeping me. I remember I think I shared this with you guys. I had went into a building and the elevator was going up but it didn't go down. I was on the 7th floor and I had my suitcase with all my equipment in it. And I had to go down 7 flights of stairs. I know it's a lot easier going downstairs than going upstairs, but that was a lot with all my equipment. But I was able to do it, and I thank God that I was able to get down those stairs and still go see the rest of my patients and not be winded, not be tired, but was able to do it. And some of the people that I see that only got me by a couple of years, I'm 52. I see people that's 54, 56, 57, and they are not in the best of health. And I'm an example to them. I hope that if God can do it for me, He can do it for you too. But you have to make up in your mind this is something that you want to do. So I prefer to spend my money on supplements than my copay for a pharmaceutical. But anyway, it's I went by over a little bit. So thank you so much. Why a lot of mucus? Because of inflammation, and that's your body's way of responding to an allergen or infection or anything like that. So if you have mucus, you have inflammation. You look good. Oh, thank you so much. Thank you everyone for tuning in. I appreciate you. Please like, invite, and share. I am going to post some links for you guys to invest in yourselves in some of the products that I was talking about. I'm gonna do that while I'm on here. If you guys want to stay on a little bit longer, and if you have any questions, I can answer some questions for you. If you want me to answer any questions while I post these links that I have, where's the links? Where is the links? If you have any questions, anybody have any questions, any comments of anything that they want to talk about? Is there any questions? Any comments? Let me see here. I'm in my inbox. Where's the link? Yep. Any questions, comments, anything that anybody might have? Okay, guys. Well, you guys, thank you for tuning in. I'm Dr. Grace Patterson, managing owner of Bethesda Holistic Center and Everything New, alternative medicine. We are here every Monday at 8 o'clock doing Medical Monday. So if you guys want to get in touch with us, please call us at area code 248-356-1111. Our website is www.bw-center.com. Please get in touch with us. If you know anyone that's sick and shut in and it can't get out, like I said, we do visiting. We do have a visiting practice that we go to your house to make sure that everyone is okay and everybody is all right, and all that good stuff. So we actually bring the doctor's office to the home, and we actually do infusions, natural infusions for people, vitamin B12 infusions. We actually do the vitamin testing for our seniors. Medicare pays for it, but there is a $125 copay. I'm very transparent about everything, so no one can say they didn't know. And again, once you get that information, it tells you to the milligram dose how we need to supplement you, and tells us for how long and what foods to incorporate in your diet and in your food choices, right? You can't beat that. Okay, that is a wealth of information that you need for a healthy life. You cannot, you cannot say that it's not worth it. So please, guys, I really want to encourage you to take a look at what we offer. My screen just froze. Okay, take a look at what we offer and invest in yourself. It's very, very important that you invest in yourself because you only get one you. Let me say that again. It's very important that you invest in yourself. You only get one you. It's very important that you understand that you only get one you. So invest in yourself. Invest in yourself, because it's very important that you invest in yourself. You only get one you. Only get one you. That is so true. You only get one you. So invest in yourself. So I just posted the Cytoactives. Again, that is the vitamin D, the omega-3, and it also has the DHA and the EPA, which is also very important for telomere support. And it also has the Cytoactives for cardiac support. So please take a look at that. That may be something that you're interested in. I'm posting now the Iso Omega, which is the fish oil. I really like this fish oil because it doesn't smell fishy, doesn't taste fishy. It has a nice lemony smell to it, and it's very, very good for inflammation, for bringing down cholesterol, and helping with vasodilation of the blood vessels. Okay, so look into that. And then the Ageless Joint Support. It has the supplements along with the topical, and it's only $20. You get two things for $20. And it really helps. It's a topical. It's a it was so funny. I gave it to a good friend of mine to give to her husband because her husband told me they was having joint problems because he was doing a lot of floor work. He was a into construction, and so I gave it to his wife, and his wife started using it. She was like, "He ain't getting this, so you have to give me some more." So I thought that was really, really funny. Um, so um, so this stuff does work. So I really appreciate you guys tuning in. Please just click on the link, make your purchase, and invest in yourself. Just invest in yourself. You are worth every dime. Okay. So we thank you for tuning in to Medical Monday. I'm Dr. Grace Patterson, managing owner of Bethesda Holistic Center and Everything New Alternatives Medicine and Services. We're going to have a lot of great things that are coming your way. So stay tuned and stay posted. Again, if you need to make an appointment, 248-356-1111. If you don't want to do the vitamin testing, you can do the vitamin infusions. They're all vitamins. We just want to make sure, it's open to the public. So just call us, and so we can at least advise you in what direction that you need to go into, so we can help you get that taken care of, okay? So again, please give the office a call at 248-356-1111. Our website is www.b as in boy, w as in winter, center, center.com. Thank you so much for joining in, and I appreciate you guys so, so much. Hopefully this information is helping you, and hopefully you're getting something from it, and hopefully you're applying what you're listening to your life, so you can live a long and healthy, happy life. So the blood of Jesus covers you. Grace and peace. God bless. And bye for now. Until next time. See you next week. Same time, same bat station. See ya. Bye.